annually thereafter. In other words, this is an ongoing requirement under Section 511 for adults, for students, and for youth. Anyone who's earning subminimum wages, this provision needs to be complied with, because Section 511 prohibits a 14C certificate holder from continuing to employ an individual regardless of age or date of hire at subminimum wages unless they're provided career counseling and information and referral services, in addition to informing an individual of self-advocacy, self-determination, and peer mentoring opportunities. Individuals with disabilities hired at subminimum wage on or before, after July 22nd of last year, have to receive both of these services every 6 months for the first year and annually thereafter for as long as that individual continues to receive subminimum wages. The individual will provide the documentation of the service to the employer. The documentation for all employees during subminimum wage employment is required to have the employer verify the completion of these requirements to review the relevant documentation that would be provided by the employee. Employers are strongly encouraged to maintain copies of this documentation, as the employer may be requested to provide proof that the services were provided to all employees being paid at subminimum wages. Now, VR and the Department of Labor both have the right to review documentation in such a manner as may be necessary to fulfill the intent of Section 511, consistent with the regulations established by rehabs, RSA, or the Secretary of Labor. This is important for employers because if you fail to comply with any of the Section 511 criteria for paying a subminimum wage, the Secretary of Labor may assess back pay or any other appropriate relief in the same manner as there would be against any other employer who failed to pay the minimum wages under the Fair Labor Standards Act. The Wage and Hour Division is authorized to seek back pay at the full minimum wage rate for each individual for whom the mandatory services or documentation is not provided or does not meet the established criteria. There is a small business exception in the event a certificate holder is a business with fewer than 15 employees. The requirements can be satisfied for 511 by referring individuals for those services through vocational rehabilitation. There is a refusal provision through informed choice. An individual earning subminimum wage can refuse to participate in the 511 process. However, this refusal must be documented per specific regulations in WIOA, and the business that employs the individual at subminimum wage must keep a copy of the refusal on file. As long as the refusal is properly documented by Voc Rehab, the federal regulations indicate no impact on the individual's ability to continue to be employed at subminimum wages. Now, if an individual is unwilling to go to Voc Rehab and have their refusal of the Section 511 process documented, they cannot continue to be paid at subminimum wages. The business would be in violation of Section 511 and liable for back wages. The business may continue to employ the individual, however, at minimum wage or higher. Individuals can refuse services, and if they're known to VR, or the individual's guardian may also refuse services, and through informed choice, they don't have to participate in activities required, but that does impact their ability to continue to earn subminimum wages. Voc Rehab is documenting these cases and providing it to the individual within 10 calendar days if an individual is refusing to participate. We're also providing information to the individual to provide to the CRP employer. Okay, the next slide is specific to youth, and individuals with disabilities ages 24 and younger are considered youth. They have to be provided with various services designed to improve their access to competitive integrated employment. These include transition services, vocational rehabilitation services, and career counseling services, all before they are employed at subminimum wages. So in order to comply with the requirement in Section 511, it's necessary for employers to determine the age of anyone they've hired after July 22nd of last year. If a new employee is age 24 or under, the employer must verify that the employee has completed all three of the statutory requirements prior to paying that person a subminimum wage. These requirements don't apply to youth who are already working at subminimum wage prior to July 22nd of last year, but those individuals too have to receive the annual career counseling and information and referral services that are required for all subminimum wage earners. If a youth with a disability begins work after July 22nd, the youth cannot be paid a subminimum wage unless all three of the requirements are completed, and CRPs have to maintain this documentation that the individual has been provided those services. Again, a youth or their parent or guardian can refuse to participate in the Section 511 or can opt out of the VR process entirely. However, if the individual does so, they may not be paid under a 14C subminimum wage certificate and must be paid at least minimum wage. The documentation for youth requires employers to review, verify, and maintain copies of documentation indicating that the youth has completed each of the three requirements on your slides before they begin subminimum wage. VRs are required to provide final documentation of the completion of each of these services to the youth, who again must provide it to the employer before beginning work at subminimum wage. VR must provide counseling services and information and referral within 30 days of the date the youth is known to VR and seeking subminimum wages. So we don't provide the documentation directly to the entity providing subminimum wage, we provide it to the youth. All right, and the requirements for students. Students with disabilities are not allowed to enter subminimum wage employment prior to completing activities for documentation requirements. One of these activities is the pre-ET services, the pre-employment transition services, and they're listed there. These are provided to students with disabilities ages 14 to 21. So you'll remember that youth are 14 to 24. Students are considered 14 to 21 under an individual education program plan or Section 504 of the Rehab Act plan. And pre-ET services are for all students in need of such services. They're mostly exploratory services and an early start at job exploration. Pre-ETs have to be made available statewide to all students with disabilities, regardless if they've applied for VR services or not. They must be provided or arranged in collaboration with a student's local education agency. There's a focus between VR, LEAs, AEAs, and families. Services may look different within each school district, but it should be, they should be comprised of the 5 different pre-ETs activities and services you see on the screen. Pre-ETs are only available to students with disabilities, but this includes students that are enrolled in educational programs that could include homeschooling. And just know that until VR establishes eligibility, all students with disabilities are considered potentially eligible. Okay. Look at pre-ETs as being the earliest set of services available to students with disabilities. Again, students refusing services, if they're known to VR and the student or their parent or guardian refuses through informed choice to participate in the activities required by Section 511, we document that. The documentation is provided to the student within 10 calendar days of the student's refusal to participate. This refusal will impact their ability to enter subminimum wage employment. IVRS added 2 new employment services specific to students: instructional training and supported short-term paid work experience. At this point, those services have not been officially included in the contracts with partners. However, any partner who is under contract with VR to provide Job development services and job coaching services will also be allowed to provide both instructional training and supported short-term paid work experience services. VR is responsible for the development of the job, which will be known for students as supported short-term paid work experience, and the school is responsible for the instructional training. There may be some cases in which VR is covering the cost of instructional training, but that will end as of July 1st of this year. The instructional training is training on employability skills provided to a student with a disability. Employability skills may include programming to develop social skills, independent living skills, communication, interpersonal skills, financial literacy, orientation, mobility skills, job-seeking skills, understanding employer expectations, and other soft skills necessary for employment. This service is provided in the early stages of career exploration during the student's transition process. And again, the LEA is responsible for providing instructional training, which could be provided through an instructional trainer, as example, a paraeducator, unless the LEA contracted with a CRP for job coaching types of services. Instructional training is the component that complements the supported short-term paid work experience. An instructional trainer would be responsible for being on the job site to assist the student with learning the skills needed for the work-based learning experience. The supported short-term paid work experience is a paid work-based learning experience that is short-term and provided to a student with a disability in a competitive integrated setting. This service is provided by IVRS in collaboration with the local education agency in the early stages of career exploration during a student's transition process. For a student who requires this service, an instructional trainer needs to be coordinated with the LEA. IVRS will be responsible for helping secure the supported short-term paid work experience, which could be contracted through a CRP. So next we'll talk about career counseling, information, and referral, and turn it back to Jeff.
Thank you, Leanne. So now that we've kind of laid the groundwork here, let's talk about some of the resources that are available to individuals to receive career counseling, information, and referral services to start with, and then we'll tackle the self-advocacy, self-determination, and peer mentoring, and then Leanne will talk to us about the role of person-centered planning in all of this. Okay, so if an individual wants to work in the community, they need to be referred to VR. Individuals may become known to or be referred to VR in a variety of methods. So through the VR process, or through self-identification, self-referral, referral by a 14C certificate holder or service provider, or referral by another entity such as the DD agency, case manager, even a parent or guardian. Once an individual is known to VR, then VR will undertake the Section 511 process that we've outlined already. So as we talked before, VR is able to contract with different entities to help provide these services. And RSA allows for career counseling, information, and referral services to be offered in various settings, including groups and individually, and it may combine video or digital communication, and where permitted, may be provided at the work site or at a mutually convenient location. So therefore, IVRS has partnered with the Iowa Coalition for Integration and Employment to offer career counseling, information, and referral group webinar sessions. We are offering 12 live sessions. We have completed 10 of those, and our last 2 are coming up this Friday. So if you haven't registered, please do. Please join us. But we will also be making an archive available, as we know that there were a number of individuals, parents and guardians, etc., that maybe wanted to attend live and couldn't. So we will be making that available via the VR website, and as soon as that is up and going, we will blast that information out to you that it's available and how to find it. So important part of the webinar sessions, at least from the provider perspective, is that oftentimes providers are proctoring or hosting the sessions. And so I just want to encourage you to follow the proctor instructions that are provided once you register for a session within a Google Share Drive. And another important piece, so an individual registers and attends the group webinar session, and then providers or proctors then send in the sign-in sheet, which generates certificates of attendance, which are then returned to those employees that attended. But an additional piece that is required is the follow-up conversation and the completion of the follow-up information and referral discussion form. So if you've hosted or participated in the webinar, you've heard us reference this, and that individuals are to be followed up with either with their employment service provider or another, like a case manager, to assist the individual in processing the information that was provided in the presentation and to help identify the individual's interests and next steps. So this might be the first conversation that you're having about it, hopefully not, but otherwise it's the continuation of the conversation or one of many. A copy, once this form is completed, a copy of that should be shared with the individual, as well as the family or guardian, if appropriate, and then transmitted to the case manager or care coordinator to utilize in their discussions in service planning, and to help shape that planning. And again, Leanne's going to touch on that here a little bit for us here in a minute. The content of that follow-up form reflects or mirrors the content of the career counseling webinar session intentionally. And again, it helps identify and capture individuals' interests and next steps. And on the second page of that follow-up form, there's like a yes, a maybe, and a no. And I want to talk about the no. It's important, though WIOA doesn't define informed choice, it's important that we still ensure that as supports to individuals. So there is guidance on informed choice that's been provided under Title II of the ADA and through the Olmstead decision, and there's also specific guidance on publicly funded employment services issued in October of 2016 by the U.S. Department of Justice that individuals may initially be hesitant to consider employment in integrated settings, and that it is our responsibility, our duty, that individuals be given opportunities to make an informed choice about working in integrated settings, and there's a variety of ways to do that. So just because someone says no doesn't necessarily mean no. They might not have all the information to make that informed choice. So it's important that we're providing information about the benefits of working in integrated settings, that we're facilitating visits or other experiences related to integrated employment settings like tours, job shadows, informational interviews, etc. That we're giving people opportunities to meet other individuals with disabilities working in the community and their families, providing access to benefits counseling, and making reasonable efforts to identify and address concerns or objections raised by the individual or their parents or guardians regarding employment in the community so that we can help address those and hopefully help folks continue to move forward. Case managers and care coordinators have a critical role and responsibilities in bringing employment first to life and in the provision and follow-through of the services that we've been talking about today, including shaping planning, addressing concerns, and having or continuing the conversation about community employment. So again, Leanne's going to share more about the role of case managers in shaping, planning, and supporting individuals and the partners that surround them to explore work in the community. Case managers on the phone, I just want to encourage you that it's important that you be informed on the legislation and its intention and the requirements, and that you're able to frame it in a positive way for individuals and families, as well as understand the impact to them and to the larger system. Case managers and care coordinators can and are providing career counseling, information, and referral services. So it will also be important to be informed on employment services, resources, and supports available in the communities that you serve, so that you're able to provide more than adequate information and referral to federal and state programs and other resources that support the individual to explore and attain competitive integrated employment. And that you too are building relationships that align with WIOA. RSA requires that those providing career counseling, information, and referral services be provided by professionals that have a broad understanding of the labor market and career development, knowledge about individuals with disabilities and their employment needs and challenges, and specific knowledge about resources and programs that can help support individuals with disabilities in exploring career choices and finding suitable placements. Self-advocacy, self-determination, and peer support opportunities are also required under Section 511. These services cannot be provided by an entity holding a 14C certificate. If a 14C entity employs 15 or fewer individuals, they may refer individuals to VR for these services, along with the career counseling, information, and referral. Really, right now, the best resources in Iowa related to providing these services are the Centers for Independent Living. And though they only serve 33 of the 99 Iowa counties, they are willing to collaborate and work with providers to get into communities to provide these services and support. We can also provide you a list of additional resources by community. It's on the IVRS website under partners. We can send you a direct link, but IVRS supervisors in their communities gathered what information they could on resources that exist related to these services to help kind of fill in those gaps. But we can all acknowledge that there are gaps or a lack of resources as it relates to these services. So it's going to be really important that we collaborate and be creative in helping individuals and accessing these opportunities. I just want to clarify that providers, they don't have to document that the training was provided, just that information about opportunities related to self-determination, self-advocacy, and peer support are provided. Although these aren't defined in WIOA, the preamble does provide some clarification around what these three services are. I'll share them with you here really quick, and I can also send them out. Peer mentoring involves individuals with disabilities providing guidance, counseling, and advice to other people with disabilities based upon their own experiences and training and the experience of others they know. Self-advocacy involves developing the skills, knowledge, and confidence to stand up for yourself and using appropriate means to obtain one's goals. Self-determination means having the ability, attitudes, skills, and opportunities to play an active and prominent role in living and planning one's life and future. So resources for families. So there's a couple of things here, and again, we will share all of these with you. So there's a great resource, the DOL fact sheet, and just bear with me here. I'm going to exit the PowerPoint, and I'm going to show you a couple of these directly just so you can see what I'm talking about as I talk about them. Sorry, got to find the right one. Okay, scratch the DOL fact sheet. But I will share that with you. What I like about it is that it's in real plain language, and it breaks it down really simple for a variety of stakeholders, including parents. There is a letter that was included with the career counseling sessions that Amy and I drafted. You are more than welcome to use that as well when you're communicating and talking to parents and guardians about WIOA. It doesn't have to be related to the career counseling sessions, so you're more than welcome to take that and adapt that to your own needs. ASK has developed a great resource. It's called Employment First, A Family Perspective. I've got it pulled up here. We can certainly share this with you as well. It's also available on the VR website. but this is another great tool to use to talk to families about competitive integrated employment. It does touch on WIOA. I just learned yesterday and today that Ask Resource Center is working specifically on a resource comparable to this related to WIOA and Section 511 for parents, youth, and families in schools. Leanne, we're going to
get them from Lori.
Lori Moore, and we'll be sure to make those available to you guys electronically and otherwise. But it looks like a great resource, and again, lays everything out in real simple and plain terms for families. Again, Ask can be a great resource related to WIOA and Section 511. That's a mouthful. But they're also great resources in schools and related to planning too. So I want to give a shout out to Ask. It's always good to direct parents that way. On the association's website, there's also a parent engagement tab there that has a number of resources available for parents related to both WIOA and integrated employment. And the coalition can also be a resource for families and provide opportunities for families and parents to participate. We've fielded a lot of questions and concerns via the sessions, so we're definitely open to continuing to take calls from parents and families and answer their questions and have discussions about work. But really, the best resources for families is you. We all know what it feels like, and we can all understand the fears and the worries and the confusion and the grief that comes during times of change and uncertainty, particularly when it's impacting those we love and care about the most. So if all of us can relate to what families and guardians and individuals must be going through or feeling right now, because we're probably feeling it too, right? Or we're just getting over it. And so what is one of the things that we all want and need when we're feeling this way? Well, we want information and communication, and that's why you can be such a great resource. Please learn about the law and the legislation and the resources related to it, and be able to communicate that and over-communicate it in a clear and consistent message, again, about what the legislation is and its intention and how it's going to be impacting them as an individual and as a family, and then maybe what it looks like at the agency level and what your agency is doing to meet the requirements, and if it's changing or shaping programming, that needs to be communicated in a clear and consistent way as well. And then hopefully you can tell them what they can do to help minimize their fears related to these changes. So again, I just want to encourage you to learn about the law, the resources, and be building partnerships that align with WIOA, and then to communicate, communicate, communicate. And so without further ado, I'm going to hand it over to Leanne Moskowitz to talk about WIOA and Medicaid-funded HCBS services related to employment and person-centered planning.
Wow, that's a mouthful, right? Thanks, everybody. So I want to thank you for the opportunity again just to talk a little bit about more HCBS and person-centered planning. And so I'm going to try and be brief. We want to leave a few minutes, I think, for question and answers at the end. And I can, talk forever and a day about Medicaid and HCBS, so we'll try to be brief. So I want to talk about the plan. And so when we talk about the plan, we're talking about the comprehensive person-centered service plan. And that comprehensive person-centered service plan is the foundation for all HCBS services that a member will receive or participate in. And so that's the foundation. And so we want to build our house on a strong foundation. And so we want a real comprehensive, strong person-centered service plan. The member who is participating in HCBS will have either a case manager or a care coordinator, regardless of whether they're fee-for-service or enrolled in a managed care company. And some lucky individuals will have both care coordinator and community-based case manager, depending on which plan you're participating with. And so that individual is responsible to facilitate the member's interdisciplinary team. The interdisciplinary team are the team of folks that the member requests to be present during the person-centered planning process. So this could be a representative, a guardian, could be mom, dad, sister, brother, coworker, and it's really important that the service providers be there. So if the member is new to HCBS services, if they have a care provider identified, it would be great for them to be at that initial person-centered planning meeting. And if a person is doing an annual review of their person-centered service plan and service needs, those same providers of those services need to be present and responsible for the content of the service plan. Also, the contributions of any professionals that that member may see, whether it be therapies, behavioral health, those types of things. Those folks need to either participate directly in the meeting or contribute through submitting reports and those types of things of what their recommendations are for the next service period for members. So the IDT, the interdisciplinary team, in conjunction with the member, reviews the member's need for services and develops the comprehensive service plan or the comprehensive treatment plan. If a member is getting strictly integrated health home care coordination services and are enrolled in an integrated health home, they're going to have an overarching treatment plan that needs to incorporate the service planning requirements. So the case manager or the IHH care coordinator is also responsible to monitor the service plan implementation and service delivery to ensure the member is receiving those services that are identified in the service plan and that those services are achieving the desired outcome. So that's our plan. So when we're talking about HCBS service and support, so we talked about our foundation. We've got our HCBS Comprehensive Functional Assessment, which assesses the individual's need for HCBS services. The IDT develops the service plan or the integrated treatment plan, and the individual service plan or the integrated treatment plan is what defines the services and supports that the members will receive. If it's not documented in the service plan, the member's not going to be getting it, and Medicaid won't pay for it. And so we need to make sure that, again, that service plan must be comprehensive. We need to know what folks are supposed to get, when they're supposed to get it, how many units of service they're supposed to receive, who's going to deliver those services, and what the goals and activities around those services are. So when talking about person-centered planning in the context of HCBS, we want to think about the person. The person's at the center of that, and when we're talking about employment, we want to talk about what are individual preferences. What are any natural or paid supports that that person already has in their lives supporting that person's goals or preferences? And what type of scheduling lifestyle does the person have? If we're talking about employment, is this a night owl or an early bird we're talking about? You know, should we be focusing our employment and goals and activities around looking for something that's conducive during day hours or evening hours or the overnight shift? You know, are we talking, and what type of you know, job are we talking? So we want to be flexible in the scheduling. Again, the person-centered planning also has to be at convenience of the member. These need to be taking place at locations and times that are preferred by the member, because we want the member to fully participate and engage in their person-centered plan, because this is for them. This is all about them and how they want to pursue their goals and preferences during the next year. So that person-centered plan also has to look at any technology that the person utilizes or could utilize in order to become more independent. And when we're talking about independence in the workplace, is there supportive technology that the person could leverage in order to become more independent in their job, either initially or with ongoing training and support. So we have to think about all those things in person-centered planning. So with the service plan documentation, again, it has to reflect strengths and preferences, clinical support needs, and it has to include observable, measurable goals with the desired outcomes. And so if my goal is I want to be competitively employed in a dog grooming business, then what are those individual activities to get me there? Well, I probably need to learn about different types of breeds of dogs or cats and I probably need to learn how to identify different grooming styles, maybe get grooming certified, those types of things. So what are the action steps that I need to get on my way to my job that's desired, and which providers are going to support me in getting there, and what are those specific action steps and supports that are going to help me get there? And so identifying those observable, measurable goals and outcomes. We got to identify the interventions and supports needed to meet those goals with incremental action steps as appropriate. So we know we don't all go from conceptualizing what my job goal is to job attainment. There's a lot of things we do along the way to get prepared and to, sharpen our knowledge, skills, and abilities so that we can get that job. We need to identify the staff, people, businesses, or organizations that are going to carry out those interventions and supports. So if a member's getting natural support from a coworker, we need to say that in the service plan. If the member is receiving paid supports, either through VR or already receiving them through the waivers, say receiving long-term job coaching or participating in Enclave or individual supported employment, we need to say that. Who's the business that is providing that service? How many units of service am I supposed to be getting a week? How long am I going to be getting those services? And what's the expected outcome at the conclusion of that? The person-centered plan, again, for someone then receiving pre-vocational services, it'll be very important for that service plan to document where is the member to receive those pre-vocational services, the number of hours a day of on-site supervision that person needs, the plan for when the member will participate in those career exploration activities, the status of providing the member with information regarding supported employment, the benefits of work, and referral to supported employment services. And this is so important because we know that pre-vocational services is not a stopping place. It is a stepping stone on my way to integrated competitive employment. And so we want to make sure that our service plan is fulsome and it accurately and descriptively documents what information I've been given about supported employment and what have been the choices that I have communicated about my preferences around supported employment, and have I been referred to VR or any other type of employment services? Iowa Workforce Development. I believe DRI is doing counseling, career counseling now, and so there's different types of organizations for different types of services that the member could benefit from that aren't necessarily going to be funded by Medicaid. And so it has to be very clearly documented. And then if the member's been referred to VR, what is the status of that referral? Are they actively working with VR? Are they, waiting for a counselor assignment or just, a note at the time the service plan's documentation is occurring, what that status is? And so that would be for someone receiving pre-vocational services. And again, why do we care? Because the majority of folks who are receiving pre-vocational services are also being paid subminimum wages under a 14C certificate by the pre-vocational service providers. And so that's why we care. And in the spirit of collaboration and cooperation, we want to make sure that, number one, we're in compliance with CMS's requirements for home and community-based service plan documentation, and number two, we're being good partners with the other state agencies who are responsible for oversight of WIOA and ensuring that our documentation can help support those providers of the services. And by having a comprehensive, well-documented service plan around employment, that not only provides that member a path on which to follow and providers a path on which to follow to help the member achieve their goals, it also provides that service provider the documentation to support that this member is having conversations around supported employment with their interdisciplinary team that's being documented, and that we have a record to preserve about those conversations. So supported employment, the expected outcome of supported employment, of course, is sustained employment or self-employment paid at or above minimum wage or the customary wage and level of benefits paid by employer in an integrated setting. And so we want to make sure that if a person is in a current position where they are receiving supported employment services, that we document, is the member earning the wages that they want to earn? Are they working the number of hours that they want to work? Are they employed in a job that meets their needs and is fulfilling to them? Or are there additional things that we need to do to support that person? Do they need additional information about other types of employment available in the community? Where can we send them to get their information? So while we don't necessarily expect the integrated health home care coordinators or the community-based case managers to be experts in the job market in their communities, we do expect them to know where to refer the person to get that appropriate information and to receive that type of information and services. And so we do expect care coordinators and community-based case managers to be familiar with the communities in which the members live, in which they're serving, and to be familiar with all of the publicly funded services and supports that might be available to someone. So, with the service plan documentation for supported employment, we would want to make sure that the member's place of employment at the time of enrollment is documented, that the member ongoing place of employment is documented when we are doing our service plan reviews, the number of hours of supervision needed, the number of workers who work with the member, and if they have been referred to VR or not, and the stat, again, is the service actually meeting their needs, or do we need to make some adjustments? Do they need additional support? Is it time to back off on the support? Do we need to look at putting in some additional services in order to help them achieve their goals? Again, the person-centered plan is a reflection of the member's goals and preferences for the next service year, and what they're going to receive, how much, by who, and when, and are there any other types of considerations we need to take into place? Does the member have any risks that need to be mitigated in their job search process? Are there some jobs that may not be appropriate for the person due to either health, safety types of risks? And is there anything that we can do to mitigate those risks so maybe we're not constricting the individual in their choices? And so, again, a well-thought-out, well-documented service plan will capture this information. Service plan documentation, again, has to include the person important to supporting the individual, includes the names of all the individuals responsible for monitoring the plan, needs to be written in plain English. It needs to document who's responsible for monitoring the plan. It needs to be signed by everybody involved. So any service providers, the member, the guardian, whoever is participating in that service plan development, who is responsible for the services identified in that service plan, must sign that service plan. This is a federal requirement. It's also federally required that the document get distributed to the individuals and others involved in the plan. That means the individual gets a copy of the service plan, and any service providers responsible receive a copy of that plan. And I know that's been in dispute, but it's a federal requirement. The member must have a copy, and the providers must have a copy. And it's so important because the provider of that pre-vocational service or the provider of that supported employment service must have an individual service plan for pre-voc or an individual service plan for supported employment on how that provider is going to incrementally assist that member to meet that goal of long-term job attainment or maintenance. So, and then of course we want to make sure that we are excluding anything that's duplicative, unnecessary, or inappropriate. So I just want to reiterate, we're cutting into our question Q&A time. But it is not, you know, the IME or Medicaid CMS does not have oversight of the WIOA legislation or Workforce Innovation Opportunity Act legislation. Again, it is RSA and Wage and Hour Division of the Department of Labor that has that oversight. But the IME is responsible for enrolling providers of pre-vocational services who may also be 14C certificate holders, and we require our service providers to comply with any federal regulations that apply to the services that they're delivering. And in delivering services under that subminimum wage certificate, again, we're partnering with VR and just reiterating the importance of good documentation around employment and employment supports, and how folks are receiving information and participating in opportunities to get information, and how that is being translated into everyday service delivery. So thank you very much, folks.
Thank you, Leanne. See if you have any questions or comments, please share them there in the question section of the control panel, again along the right-hand side of your screen. Looks like no questions yet besides the one that was shared. The one that was shared was just asking again if we were going to make the presentation available, and yes, we will. There'll also be a number of resources that come along either as attachments or the links directly to, and again, those were resources for providers and families and case managers and the like. So look for lots of stuff to come along with the recording and follow-up after the webinar. Again, here's our contact information. No questions.
I'd just like to refer folks back to the second reiteration of the Employment First Guidebook.
Yes.
If case managers and care coordinators, even providers, if you're not sure where to get started during the service plan on having that conversation about employment, employment supports, and developing employment goals, then that guidebook is just a great resource to utilize, refer to, open up at the meeting and have a conversation about. So the second edition has been published to the IME website, the IVRS website, the MHDS website. I believe it's also on the CDD website. So if you want it, you should certainly be able to find it. And we also have an updated frequently asked question document on the IME HCBS website. And that was just updated in January, and we're trying to keep that updated as we receive additional questions regarding the Medicaid services. So hopefully you're using those tools. There's just an abundance of them out there, and a lot of great minds went into putting that stuff together. So I hate to see it go to waste.
Go to waste. And I pulled that slide back up again that has the link directly to the Employment First Guidebook. But I will be sure to send that out again and probably even attach a PDF for you if I can. Same is true for the Employment First, a Family Perspective Guidebook that was developed by Ask Resource Center. Again, kind of a jump off of that Employment First Guidebook that was developed for case managers and providers. And again, Ask is also making available a nice tool that's called the Workforce Innovation and Opportunity Act, what it means for Iowa youth, families, and schools. And again, we'll make sure that we share that with you as well. So I think we can go ahead and wrap up here. I want to remind you again to please complete the survey that's going to launch after the webinar. It's the same 3 questions that you're familiar with, so please complete those. We really appreciate it. And join us again on June 13th when we're going to have the lovely Leanne Moskowitz back again with Luna Bacam. And they're going to talk about, again, and kind of get into the weeds a little bit because we rushed her today, on the role of person-centered planning in achieving integrated employment outcomes. And this is going to be a great webinar for both providers and the case managers, community-based case managers, IHH service coordinators, and the like. So please invite your case management IHH friends to join us that day, and we'll see you again June 13th from 1 to 2 p.m. And look for the follow-up with all the materials. And then again, I'll send you an invitation to join us in June. Have a great rest of the day, everybody. Bye-bye.